Assalamualaikum and hello to everyone. My name is Dr. Najmi. I'm a gastroenterologist and hepatologist from Sunway Medical Center, Ipoh. Let's get to know a bit more on inflammatory bowel disease. Inflammatory bowel disease is a chronic inflammatory condition of the GI tract, which mainly consists of Crohn's disease and ulcerative colitis. It results from abnormal immune response, leading to prolonged inflammation and can lead to damage to the GI tract. It's different from other type of colitis, for example, infection, because this is not infectious or contagious, and it's usually not self-limiting, which means it cannot resolve on its own or with simple antibiotic. Crohn's disease can affect any part of the GI tract from mouth to anus, and in Crohn's disease also the inflammation tends to be more severe. It involves all layers of bowel wall, and in severe cases, complications include narrowing of the bowel, what we call stricture. It also can lead to fistula, whereby there's a connection between bowel and also other organ, for example, bladder. And in severe cases, it can lead to perforation, whereby the patient have pus collection in the abdomen. While in ulcerative colitis, it mainly confined to the colon and rectum and affecting only the innermost lining of the bowel. And in severe cases of UC, patient also can have bowel perforation, and long-standing inflammation can lead to colorectal cancer as well. Common symptoms of IBD include persistent diarrhea. Sometimes patient might have rectal bleeding or mucus per rectum. They also can have abdominal pain or cramp. They might feel fatigue with unintentional weight loss. They also might have unrelated GI symptoms, for example, eye redness or soreness, mouth ulcer, skin rashes, and most of them probably have joint pain as well. The exact cause of IBD is not fully understood, but it's most likely due to multiple factors. Number one, genetic components. Patient with specific gene, they're prone to have IBD. Similarly, if the patient has family history of IBD, they're prone to have IBD. Number two, immune system dysregulation, whereby our own immune system attacking the bowel. And last but not least factor is the environmental triggers. For example, westernized diet, fast food, they can increase the risk of getting IBD. Similarly, smoking, unhealthy habit, and study also has shown there's a lot of usage of antibiotic during the early life. It also can increase the risk of getting IBD. IBD is rare in Malaysia, but the incidence is increasing. And this is likely due to the urbanization and changes in the lifestyle. In terms of the incidence in Malaysia, the local study has shown about 1.5 cases per 100,000 person year. And when we compare with the Western country, for example, in United States, they have much higher incidence, about 721 cases per 100,000 person year. And when we look at the age of onset of IBD, it's usually affecting younger population, about 20 to 40 years old of the age group. Although the second peak of the disease can happen at the later stage at 50 to 60 years old, especially in UC patients. Currently, there is no cure. However, a lot of treatment can effectively manage the symptom and induce the long-term remission. For example, we have anti-inflammatory medication, steroid, mesalazine. We also have immunosuppression agent. Now we have biologic therapy, and more recently, we also have advanced therapy in terms of small molecule drugs. Although some patients, in severe cases, they might need a surgery as well. But more importantly, the patient have to manage their diet and try to reduce the stress. Is IBD similar like IBS? The answer is no, because IBS, irritable bowel syndrome, is a functional gut disorder, which means it can affect how the bowel works and causing troublesome symptom, but actually without any inflammation or real damage to the lining of the bowel. On the other hand, IBD, inflammatory bowel disease, it involves long-term visible inflammation of the bowel, and it can lead to chronic damage if left untreated. There are a few key steps in managing IBD, especially for the patient. Number one, they need to stay informed about the condition, know the natural history, treatment option of IBD. Number two, regular medical follow-up by the specialist. Number three, try to adherence to the treatment plan, again outlined by the specialist. Last but not least, you need to take care of your health in terms of your diet and reduce the stress. I hope you have learned something on IBD. If you have any symptom or wants to know more, please come to Sunway Medical Center Ipoh. I'm more than happy to share and discuss with you.